Hello, dear Akrist. I share you today a study that I found interesting since we are looking for new medications that are helping us out when fish have a bacterial infection, particularly when we are dealing with more and more antimicrobial resistance. That means antibiotics who don't work anymore and are not able to cure the fish because the bacteria became resistant. And this is here an experimental study about levamisole, which used to be or is an anti-worm, anti-parasitic medication. And in this study, it was incorporated in the food and evaluated with the resistance and the fish health against Pseudomonas aeruginosa from the tilapia or Oreochromis niloticus. This study was done in Egypt, which I found interesting because it had some impact in general on the idea of what medications can we use. And since there are more and more reports coming out that certain nematode or anti-worm medications can be effective against other diseases. And one example is, of course, ivermectin, that has proven to be also effective against the viral infection of the COVID-19. India used it quite often for the population, and it was called fake news, but eventually the studies proved, 100 studies proved that ivermectin is an interesting product to use also for viral infections on humans. Well, maybe also for fish. Well, look at this. This is about levamisole has an effect against bacterial infections. So I will go here. I indicated in this study the most important parts in yellow. I will read through it. The detailed article I will publish below, so you can go into more in detail on the detailed technical studies they done. I don't want to talk to you about it because those studies are interesting for you when you're a scientist, but for you as a fish breeder or an importer or exporter of fish or a breeder or a hobbyist, I will tell you the major parts which teaches us lessons about the application of medications that can be useful. Well, Pseudomonas aeruginosa is a very common disease that has a big impact on the fishing industry, also a risk of human health. This investigation was done in two steps. The first step was to examine the prevalence and the antibiogram of the Pseudomonas among Nile Tilapia from agricultural farms in Egypt, with emphasis on their antibiotic resistance. The second step was to investigate the effect of levamisole as a feed supplement for tilapia on the growth performance, the immunity, the serum biochemistry, and the protective effect against artificial infection with the previously isolated Pseudomonas, which they isolated from the first step. 100 samples of morbid Nile tilapia were collected in the first step. That means to challenge, to check on the availability or the presence of Pseudomonas. And it was found that Pseudomonas was 40% susceptible to 9 antimicrobial agents, that means antibiotics. And about half of them were multi-drug resistant. That means half of them did not respond to the antibiotics, to 50% of the antibiotics. And all of the isolates were sensitive to amikacin, ciprofloxacin, and norfloxacin. Two seems to be still having a positive result when you treat this Pseudomonas infection on the tilapia. But half of them were resistant to azithromycin, amoxicillin, and tetracycline and sulfa with trimethoprim, which are commonly used. And well, then they did some diagnosing on, well, the RNA gene, and they detected that, well, antibiotic resistance for certain strains. I'm not going detail on that. We know that certain bacteria with certain strains can be resistant. In the second step, there was a 2-month feeding trial on 160 tilapia, which weighed approximately 56 grams, and they were distributed in 4 groups, and each at a rate of 10 fish per aquarium in 4 replicates, and fed on a diet of 0 levamisole or 500 milligrams per kilogram, 750 or 1000 milligrams of levamisole per kilogram fish food. And at the end of the feeding trial, fish were challenged with the Pseudomonas. So they were infected. They challenged an infection to see what the response was when they had levamisole in the food. So the result in vivo trials showed that the levamisole safely improved the growth and immunity of the tilapia without side effects on the liver function, because the liver can have damage by certain treatments. But this is the abstract, and I will show you some details of the study. We can go through it quickly or not. Well, to mention here, compared to conventional antibiotic treatments, the use of dietary immunostimulants, such as compounds of synthetic origin, is thought to be a preventative strategy of fish diseases, which I promote a lot also in my Dr. Bassleer biofish food, but also in general in the aquaculture and ornamental fish industry. It's commonly used to use immunostimulants in the diet. And levamisole hydrochloride is one of such instances. It is a synthetic imidazole derivative, an antibiotic, that is used to treat parasitic diseases in fish, cattle, and also in humans. And when included in the fish diet, such as the Nile Tilapia, it has been shown to be positively affect the immune system. The studies are here linked below. You can go, when you have the article, in detail to learn more about it. So the first step, of course, was to look at the Pseudomonas and what kind of antibiotics are effective or not effective anymore. And they examined 100 tilapia, which they collected from different fish farms in Egypt. They were studied at the Animal Health Research Center, and to look for lesions, and according to certain standards, they collected all those bacteria, you can say. They go in detail how they did that. I will not tell you. You can read it if you're interested. The second step was the in vivo experiment with 160 fish that were collected from a private farm in Egypt. And after a 2-week acclimatizing period, healthy fish were randomly divided in 4 groups. So they selected the healthy fish, you can say, the ones who are able to go through the testing. And they were divided in 4 groups in glass aquariums. So each group had 40 fish. And they had a control group, that's the G1. And then they had group 2 with 500 milligrams, group 3 with 750 milligrams of levamisole, and group 4 with 1000 milligram levamisole. And they were all receiving a standard basal diet, a diet that is commonly used for tilapia, which sounds very similar to Dr. Bassleer biofish food, with fish meal about 50%. And they had some corn, they had yellow corn, gluten, they have soybean, wheat meal, soya oil, minerals, vitamins, premix. You can see the details here. It's a common basal diet commonly used in aquaculture, particularly tilapia. And the results of the first step is the examination of the Pseudomonas, that the fish were collected and they had hemorrhagic all over the skin, redness at the base of the fins, fin erosion, detached scales, eye opacity, so cloudy eyes, you can say. And internally, the affected fish showed a gill lesions, so gill rot, enlarged abdomen, I would say dropsy, and spleen, and a pale liver. Unfortunately, I couldn't find any pictures of the diseased fish in this report. They should have done it. And here they show the antimicrobial susceptibility of Pseudomonas and the resistance of the the Pseudomonas against certain antibiotics. And you can see here the resistance is nearly 50% against tetracycline, 28% against gentamicin, no resistance against amikacin, no resistance against norfloxacin and ciprofloxacin, but 50 resistance against sulfonamides and macrolides. Different strains, different resistance. I'll go further on. Then the second step, they did a study on, infected fish. The study infected fish with skin and mouth, tail rot, and corneal opacity and distant abdomen. And they did the study when they infected the fish with the Pseudomonas in the testing group, which had levamisole. They found that giving a good quantity of levamisole give a positive result. Less disease, less mortality. And the group which had no levamisole had a higher mortality and a very poor survival rate. So particularly the higher dosages of levamisole was giving a better survival rate. I will go in detail with the results they show here. I will not show you here the electrophoresis. That's all science you don't need to know. Here were the clinical signs of the fish. Well, I want to show you that picture, of course, of the fish which were infected in the experiment. You see the enlarged abdomen here, like dropsy. You can see here the tail rod of the tilapia, and inside there was a lot of acetic fluid inside the abdominal cavity, and the spleen was very enlarged. I show that sometimes in my observations in my fish disease cases. Look at the fish disease cases. I show these kind of diseased fish and what I found with the microscope. They didn't show any microscopic observations. Anyway, this shows a pathological influence of the Pseudomonas on the health of the fish. And here is the mortality rate. And you can see the G1 was the group which had no levamisole. There was 8 fish died. With a little amount of levamisole, 5 fish died. And very few fish, only 2 or 3 died with 750 milligrams levamisole or 1000 milligrams levamisole. Here we see again the table of the survival rate, that these groups here, the mortality rate was much lower and the survival rate was much higher in the groups which had more levamisole. Also, the doses on the growth of the tilapia was much better here in this, particularly the 750 milligram was in general, in my opinion, the best result. You can see it also here and also here. So 750 milligram levamisole for 1 kilogram of food. And here on the growth of the fish, you can see that the fish grow very well. Weight in the G3 and in the G3 750 milligram again. Also affects the leukocyte, phagocyte effectivities. That's all experimental studies done on the details. Well, how does it affect in general the fish quality, the fish health? It goes all in detail. I don't go all the way in detail. The hematological effect, well, it shows again that the higher levamisole didn't have a bad effect, had even a positive effect, particularly the G3 group of 750 milligram per 1 kilogram fish food. Here the different dosage on the liver function. You can see here, it goes in detail. Well, it had not a bad impact on the liver function. That's mainly what it says. Although the higher dosages seems to have a rather effect, but no mortality effect and no disease. So I don't go in detail. You want to read it, but I certainly want to give you the conclusion that the results of the first step, the isolation of the Pseudomonas aeruginosa, was found in 40% of the tilapia. So 40% of the fish they collected from the fish farms had this bacterial infection, and half of them were resistant to 5 to 6 antibiotics. So there seems to be an overuse, a bad regulation of the use of antibiotics, and it seems to be considered that it has to be more under control. Creating antimicrobial resistance is very bad. Like I always say, apply an antibiotic when it's needed, not just do it in there when you don't know what the disease is. You have to really define if there is a bacterial infection that needs to be treated. And the best way is also to find out which antibiotic is the best. So do antimicrobial testing in a laboratory, particularly when you are a breeder or an importer. You should do that to find out which antibiotics work. And that can depend on the supplier and on the fish. And that you can repeat in the coming months and years. Sometimes you can use that same approach. And they find out, of course, that when using the alternative treatment, like Levamisole, the 750 milligram is the ideal for the fish to have a good result in the growth, in the survival rate, and should be thought about as an interesting method of, well, applying something else than an antibiotic. Still, determine first that there is a bacterial infection, maybe also parasites on the skin affecting the fish, or in the gills damaging the fish, or internal parasites affecting the fish. This study should have done a broader examination of the tilapia, something else than studying the bacteria. That's my critics on some scientific studies done. They only look at the bacteria. Why don't you look also at how are the fish being kept, overcrowding, dirty water, which has a bad impact on the health of the fish and can create the Pseudomonas infection? Yes, overcrowding, poor filtration, dirty water, poor feeding practices, holistic thinking. Think about parasites and also can be on the fish, not only the stress of the environment or the food, but the parasites like kill flukes, Spironucleus parasites, Costia or Ichthyobodo on the skin, Trichodyna, many things that can have an effect and a result that bacterial infections occur. And bacterial infections, of course, are killing the fish, not particularly the beginning with a parasitic infection, but a secondary infection. And here they only looked at the bacterial infection. I would have recommended also to check those tilapia. Levamisole helped. Yes, maybe they had worms. Maybe they had nematodes that have been treated with this medication and therefore the fish survived. My critical input. Think about it when you do research. Think about a total examination on different pathogens. But of course, interesting to learn that levamisole can be helpful to control this kind of bacterial infection. Subscribe. Look at my other studies if you want to learn more. Thank you for watching. Bye-bye.